Hello and welcome to the YNOT Health Project. Today we'll be talking about the concept of obesity. Obesity can often be correlated with words like fat or unhealthy, when in reality many of these associations are often dictated by aesthetics and inaccuracies of BMI measurement. How did the concept of fatness and obesity become perceived as a threat within society? What is body fat? Bodily fat is a self-storage of food reserves, and over time, genetics have evolved to favor fat storage. By the mid-19th century, being excessively overweight or obese was labeled as a cause of ill health. A century later, obesity was declared deadly because it heightens the risk of premature death. Morbid obesity, which was even more deadly than obesity, results in patients having difficulty performing daily functions such as walking and breathing, and is at increased risk for many serious health problems. However, being overweight and being obese are two different categories, and they are generally distinguished by BMI. BMI is a measurement defined by the ratio of one's weight to their height. When a person's BMI is over 30, just over the overweight range of 25 to 29.9, then this person is considered obese. However, actual body fat percentage can only be determined by also considering information like waist circumference and muscle mass. While BMI, to an extent, aids in estimating healthy weight, it is only dependent on height and weight, and it does not take into consideration different levels of adiposity based on age, physical activity levels, and sex. For this reason, it is expected that it overestimates adiposity in some cases and underestimates it in others. In general, it may overestimate body fat in athletes and others who have a muscular build, while underestimating body fat in elderly and others who have lost muscle. Additionally, there are even studies suggesting that BMI alone frequently misclassified metabolic health. For instance, more than half of those considered overweight by BMI had a healthy cardiometabolic profile, including a normal blood pressure, cholesterol, and blood sugar. About a quarter of people with normal BMI measures actually had an unhealthy cardiometabolic profile. Aside from misclassifications, there are various factors that contribute to obesity. At its most basic, obesity is due to energy imbalance, so in theory, anyone can become obese if they consume more calories than their body can use and burn. If the energy input from calories is greater than the energy output from physical activity, the body stores the extra calories as fat. As more and more calories are consumed, the fat storage grows larger, leading to obesity or, at the worst case, morbid obesity. Mostly, the source of obesity comes from a combination of circumstances, choices, and genes, which determine how our bodies consume, digest, and process food, and influence how our bodies extract energy from food and store that energy. The increased demand for calorie-dense processed foods and the growing portion sizes accompanied by pervasive marketing and misleading food labeling results in passive overeating. Scarce resources and a lack of access to healthy, affordable foods and education impose a much greater risk in disadvantaged communities. Other factors that contribute to weight gain that are worth considering would be psychological issues such as depression and antidepressants, stress eating, quitting smoking, and certain medications such as steroids and birth control pills. No matter the cause, obesity is an escalating global epidemic that affects virtually all ages, gender, and socioeconomic groups in both developed and developing countries. Obesity is a threat to individuals' health as it raises the probability of diseases like diabetes, heart disease, stroke, and cancer. It can also put a strain on your bones and internal organs and increase inflammation. Moreover, obesity is difficult to treat and has a high relapse rate. There is, however, some evidence that well-monitored long-term changes in behavior and lifestyle can improve obesity-related health issues. Weight loss from sustained lifestyle changes or treatments like bariatric surgery can improve insulin resistance and decrease inflammation. However, it is important to note that the goal of the treatment should be to achieve and maintain a healthier weight, not necessarily an ideal weight. A healthy weight is hard to figure exactly. One size does not fit all. Some people may lose weight and some may not. health improvements are largely independent of weight change. The focus should be on getting people to be more physically active and eating healthier foods rather than looking a certain way or hitting a certain goal weight. Factors that affect healthy weight include general health, height, muscle-fat ratio and bone density, body type, gender, and age. When you actually think about it, labeling this as an obesity crisis could possibly be a disguise for deeper problems because many of our fundamental ideas about obesity are incorrect. For example, Doctors Lazar and Ahima from University of Virginia, Charlottesville, found that the true impact of obesity may not be fully understood because population studies focus on the link between BMI, health, and mortality risks without taking into account how unintentional or intentional weight loss or gain may affect these outcomes. So, what if we're fighting the wrong war against obesity? Blaming those who are considered obese does not solve the systematic issues in lack of education and access to healthier foods. We need to stop stigmatizing people for their size and instead encourage everyone to engage in healthier behaviors for their own intrinsic value. In conclusion, the roads to a fitter and healthier lifestyle should be welcoming for everyone. Thank you so much for watching, and we hope this video provided you with a new perspective on this topic.